All right, it's October, Breast Cancer Awareness Month, and we are taking your calls about your breast health. Joining the studio now by Dr. Paul Fowler. He is the Chief, Department of Radiation Oncology at MedStar Good Samaritan, as well as MedStar Union Memorial Hospital. Doctor, thanks so much for coming in.
Thank you.
Okay, this sounds kind of scary. What is intraoperative radiation therapy?
Well, women who have breast cancer and choose to keep their breast, or who are able to keep their breast, always have a lumpectomy where the tumor is actually removed. While the patient's in the operating room and asleep, radiation is actually delivered in the cavity where the tumor was, which is an added benefit to the patient because they don't have to come back for treatments after that. That's it.
That's it. Now, how's this different from the traditional radiation?
Well, standard radiation for years has been a daily treatment over a 6 weeks period. Increasingly in radiation oncology, like medical oncology, we're having personalized medicine where women, based upon their age and tumor factors, there's various kinds of radiation delivery and treatment schedules that we can use. So it's more personalized to the patient and what they have. Not every woman is a candidate for intraoperative radiation therapy.
That was my next question. Who's a candidate for it?
Women with very small tumors. We typically like to use women who are postmenopausal, have favorable prognostic factors. It's much less treatment than historically we've used, and therefore it's used for women who have much earlier tumors than later tumors. So
goes the saying about doing those exams early and checking early.
Absolutely, absolutely.
Now, is this new technology? How long has it been around?
It's been around for about 6-7 years. We've used it in Baltimore in our hospitals for about 3. There's something similar to that called partial breast radiation, which is similar in terms of the balloon, but it's done over a week's period of time instead of over one time. And it's sort of a natural progression from that.
How is this, I guess, an easier option? You know, you have a lot of people who are still working when they're undergoing treatment.
Well, it's typically for the elderly patient who lives far away where it's difficult. Those cancers tend to be less aggressive, and women who are getting screened, we find them earlier and earlier and earlier. And this allows them to get their treatment in one treatment as opposed to over a 2-month period where they're coming every day, and maybe they don't drive, maybe it's inconveniencing family and so forth. So it's really good for people like that. Okay,
all right, just one of our many advances.
Yeah, every year there's new stuff.
All right, Dr. Fowler, thanks for coming in. We're still taking your calls next door. It's house calls here is 822. The number to call to get your questions answered about breast health, 410-481-2222, partnered with MedStar Health. We'll be right back.